Kano. Normally, I watch Nnamdi Kanu a lot, and when he's doing his all those speeches, he says, "Get pen and paper because you got a lot to get through. Because if you're not in the medical line, this is not a topic that you can just listen to and just assimilate everything. So I would advise you to get a paper and pen so that you can jot some things down. So last week, precisely the same time last week, we were talking about hemoglobin genotype, and we talked about sickle cell disease. And then along the line, I noticed that people were asking questions about Rhesus disease. So a lot of people were interested in it. Excuse me. So I now decided that I was going to talk about it today. It is an equally important disease. The good news about that one is that it can be prevented if you have the right information, the right education, and the right counseling. You'll be able to get through it, and it's not a problem. So, as usual, I would like to make a start with a background. So when the disease they were talking to me about, which they call Rhesus disease, is actually called Hemolytic Disease of the fetus and the newborn. Fetus means the baby in the womb. So, but I will start with a background before I build up to the disease, so that people who are not medically trained will understand where I am coming from. And this is about your blood group, which everybody seems to know about. Blood group. Okay, so let's start. In your blood, as usual, we have the red blood cells. We talked about red blood cells last week. Red blood cells are those red cells. Among the 3 cells you have in the blood, you have red blood cells, white blood cells, and the platelets. So the red blood cells are those cells that are shaped in a biconcave disc shape that contain the protein called hemoglobin that carries oxygen from the lungs to the tissue and takes carbon dioxide back to the lungs. So this is red blood cell. So normally there are things we call antigen and antibodies. I'm going to define them, define what these things mean, so that when I'm talking you will understand. So antigen they may be proteins, they may be carbohydrates. They are substances that the body, especially the body immune system, identifies as enemy or something to attack you, a foreign material. So when your immune system identifies those antigens, they form what we call antibodies. These are proteins that are meant to fight these antigens. So this is antigen antibodies. So I'm going to be talking about them a little bit so that you know what I mean. So antigens are like enemy, while the antibodies are like defense against these enemies. So on your red blood cell, that red blood cell, which are the cells that contain the pigments that carry oxygen, on the surfaces are antigens. Okay, so generally there are over 36 blood group systems in the world, or even more, but the most significant are the ABO blood group and the Rhesus blood group. ABO blood group and the Rhesus blood group. So we're going to be limiting our talk today on those two, because they impact on blood transfusion, they impact on your baby. Those two. So let's start with the ABO. So the ABO blood group is the one that everybody knows about here. So the on the surface of your red blood cells, you have these antigens. There are 2 antigens. One is A, one is B. So if your red blood cells that you inherited have got antigen A, then your blood group is A. If it's B that you inherited, your blood group is B. You can inherit both A and B. Your blood group is AB. If there are no antigens at all on your red cell surfaces, your blood group is O. So we have 4 blood groups: A, B, AB, and O. Everybody. So whatever blood group you were born with is what you're going to be. That's going to be your blood group till you die. It doesn't change. So this is the blood group that you would have. That's the ABO blood group system. Then we have the other blood group system called Rhesus blood group system. That is dependent on the presence of antigen we call D, antigen D. So if your blood system has that antigen D, then you will be said to be positive. Your blood group will be positive. If it doesn't have it, your blood group is negative. So with the ABO system, we have A, B, AB, and O. With the Rhesus system, we just have positive and negative. So that is why you will hear that somebody's blood group. So when they say your blood group is A positive, what it means is that under the ABO system, your blood group is A, while under the Rhesus system, you're positive. That means you have that antigen D. So everybody is either you're A positive, meaning that your blood group A with the positive antigen, or you're A negative, B positive, B negative, AB positive, AB negative, O positive, O negative. So your blood group then is either A positive, or A negative, or B positive, B negative, ABA positive, ABO negative, O positive, O negative. Is based on the presence of this anti-G, anti-D. That we know whether it's positive or negative. So I hope I'm making some sense here. So now you know, everybody, I'm sure that everybody talking there knows their blood group. I am A positive. So what is the implication of all these blood groups? First and foremost, we are going to talk about briefly transfusion, because we're going to spend more time on the diseases. But let's talk about the transfusion. Normally, before you have a blood transfusion, when they're giving you blood, whether it's red blood cells or whatever, there's something we call grouping and cross-match. Your blood has to be matched. The donor and the recipient blood have to be matched to make sure that they are compatible. Because if they're not compatible and you have a transfusion, you can have a life-threatening problem that can kill you. You can have all sorts of problems from a mismatched blood transfusion. So it is important that aside looking for infections in the blood, you know, HIV, hepatitis, and all that, it is important to make sure that the blood that you're receiving is compatible with you, with your own blood. So there are two funny blood groups, like O negative. O negative is donatus. You know what they call donatus? It is what we call universal donor. So if, for example, you don't know your blood group, and there's an emergency, and they have to give you blood, and there is no time to cross-match, the blood group that you can have is O negative, because with O negative can give anybody blood. They are donators, they have no biome, they are kind. Unfortunately, they can't even receive blood from any other person apart from somebody with their same blood group. So O negative gives everybody and only receives from O negative. See? Then we also have the very wicked blood group we call AB negative. They are called universal recipient. They receive from everybody, but they don't give anybody. Wicked blood group. They only give to themselves too. Do you understand? So there's a relevance. Like me that is A positive, I can receive blood from A positive, I can receive blood from A negative, I can receive blood from the O group because they are especially O negative, which is the universal donor. But I can only give blood to my A category, and I can give blood to AB, which receives from AB negative, which receives from everybody. So that's the implication of the blood groups in relation to blood transfusion. Is about compatibility. It's about making sure that the blood that you're being given is compatible to your own blood group to avoid transfusion reactions and problems that can kill you, can kill that person. So it is very important. So that aside, having said that, so we need to talk about now, excuse me, the hemolytic disease of the fetus and the newborn. Okay, so we have understood ABO, we have understood Rhesus factor. So both of these blood groups can cause this problem. I will explain the problem, but let me go slowly. Both of them, but the ABO blood group is rarer, and the problem is milder. And it only happens when the woman is O negative and having a baby with a man whose blood group is positive. So if the woman is O negative and the person, the partner's blood group is, whether it's A or whether it's B or whether it's AB or whatever, as long as it's, you know, all those positive, they can have this problem, which I'm going to explain along the line. But it's usually milder. And it hasn't got, the problem with this one is that even though it's milder, you don't have a preventive treatment for this type of reaction. So the more severe one, which everybody is interested in, is the problem caused by the Rhesus blood group system. That is the main one. And that one, the good news is that with proper education, proper obstetrician, you will be able to avoid it. So how does that happen? It happens when the woman has a negative blood. So be it A negative, B negative, O negative, AB negative, but the woman is negative. And the husband or the sex partner is positive. So she's negative and the man is positive. That's where the problem starts. And they have a baby. Or the woman takes in. And that baby inherits the blood group of the father. So it now means that the woman is negative, the husband is positive, and then the baby in the womb is positive. So, if for any reason there's bleeding, even if it's small, maybe if the woman was pregnant and had a fall, or maybe she had a miscarriage, or maybe she had any procedure like what we call amniocentesis, coronary villus sampling, or any sampling procedure where there's a little bleeding or bleeding, and that baby's blood mixes with the mother's blood. So because the baby's blood is positive, it has that D antigen, and the mother's own is negative, it doesn't have it, the mother's immune system will identify that child's blood as an enemy. It will identify it immediately as an enemy. And then the immune system of the mother will generate that fighter called antibodies. Because the baby's blood is positive and the mother's blood is negative, the mother's immune system is reacting immediately, producing antibodies to fight that enemy that the body thinks that is going to cause a problem for the woman. So what happens in this first pregnancy? Luckily, the kind of antibodies the woman's immune system produces is the type we call IgM. It does not pass the placenta So the placenta is that afterbirth where the baby gets their nutrients, oxygen, and everything from the mother. So that IgM doesn't cross the placenta. So what it means is that that baby is fine. That baby will not be affected by this reaction. That baby will be fine. The woman will deliver that baby, and the baby will be fine. That is where, that's how it is. And mind you, the woman is never affected by this reaction. Is that baby? Is babies. So, okay, this first pregnancy now, this first child will be fine. So the problem starts when the woman is pregnant the second time. And if, unfortunately, that second baby is also has a positive blood. Remember, the woman has negative blood group. If, unfortunately, this baby is also positive, and there is bleeding, and the baby's blood mixes with the maternal blood, the mother's blood, if it happens, the mother's immune system that has been primed since against that positive blood will go on overdrive and produce all these antibodies, and even the ones that have been stored will be released to fight this enemy that is coming. But unfortunately, the kind of antibodies that are produced this time are the type we call IgG. They can cross the placenta and go and attack the baby's red blood cells. They will just go and stick to the baby's red blood cell and start attacking it. It's an enemy. It identifies it as an enemy, and it starts attacking that baby's red blood cells. This is where the problem starts. How bad it is depends on how far the destruction occurs and how quickly it occurs. So what happens? What happens is that these antibodies are now attacking that boy's or that child's red blood cells, and they start breaking down. So that breakdown of the red blood cells is what we call hemolysis. Hem is blood, lysis is breakdown. So that's why that disease is called hemolytic disease. Hemolytic disease. So it starts breaking it down. As it breaks down, organs of that baby's organ, like the spleen, the liver, will go on overdrive to compensate for this destruction. So in the process, they become enlarged, and they produce immature cells that are not as effective as the normal red blood cells. This is the condition that is called erythroblastosis fetalis. So when all these fetal red blood cells are produced that are immature, that cannot do the job in the womb, at that point in time, you will say that that child has developed erythroblastosis fetalis. Then something else keeps happening. If the red cell keeps breaking down, the red cells keep breaking down and keep breaking down, at some point the baby will not have enough red blood cells to do the work of oxygenation. So what can happen? The heart can fail, what we call anemic heart failure. If that baby's heart fails, the baby will just be swollen and there'll be a lot of fluid around the baby. That's what we call hydrops fetalis. Hydro is water, fetalis baby. Hydrops fetalis. It is a very serious condition, and most times those babies don't survive it. They die. The baby will have a stillbirth. Then that's not where the problem ends. So as the red blood cells are breaking down, these antibodies are attacking it. There's something we call bilirubin, which is one of the products of that breakdown, which is normally is found in blood, but is not normally a lot. But as these cells are breaking down, the bilirubin is accumulating, is accumulating, is accumulating, is accumulating. As it accumulates, it becomes excessive, and we call that hyperbilirubinemia. Hyperbilirubinemia. And it gets to a point where it is deposited in the brain and the central nervous system and cause permanent damage neurologically. And in that condition, we call it kernicterus. Kernicterus. That is what it is. It causes permanent disability. They have learning disability. They may develop cerebral palsy. They may go blind. They may go deaf. You know, these are all the things that can happen from this reaction, just because the woman's blood is negative, the man's blood is positive, and the child's blood is positive. So I'm not saying that before you marry, both of you must be positive. If it's positive, it's better. It is better. You will not have this problem if both of you are positive. But if she's negative, there's help, which I'm going to discuss. So this is what we call hemolytic disease of fetus and newborn. So I've talked about erythroblastosis fetalis, I've talked about hydrops fetalis, I've talked about kernicterus. And then that is when it's severe. You can have mild anemia, mild jaundice, you know, and the woman's immunological system can help and, you know, deal with the issue if it's not severe. You know, the problem will not happen when that child is born. The mother is no longer there to supply, you know, help with fight of infections or all these immunological problems. So the child will be on their own. And their immunological system is not mature. So what happens? They are, you know, the anemia continues, the jaundice continues, the brain damage continues. You know, these are severe cases. And then they have all these problems I told you, you know, kidney failure, blindness, deafness, cerebral palsy, learning disability, permanent. You know, it's not a joke. So when that child is born, is either the child dies, you know, and is born dead. That's what we call stillbirth. Or the child, you know, comes out quite pale, quite jaundiced, you know, failure to thrive, you know, not active like a normal baby, you know, with swollen tummy, swollen liver, swollen spleens, all the organs are swollen, you know, very functional. You know, these are the things that can happen from this mismatch, you know. So remember, let me recap, that first baby will not have the problem. The mother does not suffer any problem. Is that second one, the second child. As long as that second child has inherited the positive blood from the father, while the mother is negative. If the man and the man are negative, they're fine. If they are positive, they're fine. But as long as the man is positive and the woman is negative and their children are positive, there's wahala. So, is there help for this? Yes, there's help. If for every woman that is pregnant who is undergoing antenatal care, your doctor would always check your blood group and know whether you're positive or negative. If you're negative, that your doctor would give you an injection, which we call Rogam, anti-D injection, which is usually given around the 28 weeks, which is 6 to 7 months in your pregnancy. So this injection mops off all those baby's blood that are in the mother's blood. It mops it away so that the immunological system does not identify it as an enemy and start attacking it. So that's what this injection does, this medication does. It stops that immunological reaction from happening. And so the injection is given at that time of the pregnancy when that problem is about to start. So it's given at that point in time to stop it from happening. It is only given to you if you have not been sensitized before. Because if, for example, you're negative and you didn't know and you had miscarriage, you terminated the pregnancy, or you had another baby before and you didn't know, you didn't take precaution, and the baby you terminated or the one you had was positive, you are sensitized already. this injection will not help you. It will not help you. So this injection only helps people who are not sensitized. Who sensitized means that reaction hasn't occurred before. The reaction I mean is the one that if you're negative, your baby in your womb is positive, and your immune system identifies it as an enemy and forms the antibodies. That reaction is what we call sensitization. If you have been sensitized, this injection will not help you. That is why it is good from day one for you to know, even before you marry, before you start considering having children, to know your blood group as well as your genotype. So if you're negative, and you will need to take this injection at 28 weeks. So when your baby is born, your baby's blood will be checked to see whether the baby is negative or positive. If your baby is negative, you're fine. You can go home. You don't need to do anything. But if your baby is positive, you will need to take that injection again within 72 hours. You must take the injection a second time within 72 hours of having that baby. That is if your baby is positive. Also, mind you that during your pregnancy, even though you have taken the injection at 28 weeks, if you had any procedure, like all this amniocentesis where needle is put through your tummy into the baby to take blood, you will need to have that injection again in between. But under normal circumstance, you have the injection twice. No, number one, just first at 28 weeks. Then after delivery, your baby's blood will be checked. If it's negative, you don't have another injection. But if it's positive, you will have a second injection. So this is how to prevent this. But if you're already sensitized, like I said before, you will this injection will not help you. So what it means is that you're on your own. So you will have your baby. Your baby will be, when you're pregnant, you will need close supervision. Your pregnancy is the type we call high risk pregnancy, where you have a lot of monitoring, a lot of blood tests, a lot of ultrasound, checking your baby growth days, checking the amniotic fluid, regular. And then if the baby is born, the baby is taken to the intensive care units of babies for pediatricians to monitor. So it is now a problem. So the advice is that you must know your blood group. And if you're negative, do not forget to take this injection at 28 weeks of your pregnancy. Even if you are negative and you had a miscarriage or abortion, you must take this injection as well. If you bled in pregnancy, you will take that injection. So these injections are taken to stop, to mop up, this blood from your system to prevent that sensitization from taking place. Because if sensitization takes place, there is no treatment. Your baby is at risk, heavy risk. Your baby is at major risk of developing all those things I told you. Erythroblastosis fetalis, hydros fetalis, canicterus, permanent brain damage, cerebral palsy, blindness, deafness, anemia, obviously death, learning disability. No matter whatever you teach, as I'm teaching now, no matter whatever I say, the thing not going to enter here. The I say now. Do you understand? So these are the problems that this issue can cause. So I hope that I made some sense. So this is the disease we call hemolytic disease of newborn or fetus and newborn, which we used to call just hemolytic disease of the newborn. And I believe we have understood is simple. It's as simple as know your blood group, know the blood group of your partner. And then as soon as you're negative, you know that you must be, having that ROGAM injection. If you bled, or if, any procedure, termination, abortion, whatever, childbirth, you must have that injection. Otherwise, your second child is at risk. That your second baby is at risk. I mean, it can happen to your first baby if you've had termination before. If you have had termination, the other baby that you're keeping, the first baby you're keeping now, will suffer if you didn't take that injection after the termination. So if you went to do a D&C or any kind of evacuation and your negative blood, you must take that injection. If you didn't, if you decide to keep your next baby and that your baby is positive, then the baby will have that, is likely to suffer that problem. So I understand a lot of people don't know about this, but I mean, it is what it is. It's there, and a lot of children are dying from it in Nigeria and so many places out of ignorance. So it's just proper education. Simple. It's very simple. Check your blood group if you're negative. And blood group test is very simple. It's not a complicated test, It's not a complicated test. They do it. If they do it properly, you're negative, okay. As soon as you know that you're negative, you just know that, okay, any abortion, any bleeding during pregnancy, I am having this anti-D injection, ROGAM. And then as soon as I have my child, they must check the blood group of that child. Maybe blood from the placenta. They will just take, from the umbilical cord. And they, take blood and check. And if the child is positive, you have another injection. It's not an expensive injection. It's not a very painful injection. It is not an injection that needs special technique. It's a very simple treatment. Very simple. So, but ignorance is the issue. Ignorance is the issue. It's not like sickle cell disease that you don't have treatment, or you have to go through massive bone marrow transplant and all that. But this is just there, and you don't have to kiss your fiance and say goodbye in this case, because there's help, unless it's ignorance. It's ignorance. But I mean, if you're lucky that you're positive and your husband is positive, I mean, you guys are fine. You don't need to worry about all this. Or if you're negative and he's negative, you don't have to worry. But you don't go loving, checking, blood group until you check it and see it. You just take precaution and your baby will be fine. This injection has eliminated this disease so massively that, honestly, it's very rare in this advanced world where I am that you see a child suffering from that. In fact, it would be criminal for your obstetrician not to know that and give you the injection. It is criminal. Here, I don't believe any doctor would even make that mistake. In fact, the knowledge is quite robust here that even the patient herself will be asking, I haven't had my injection yet. I haven't had my injection yet. She will be the one asking for this injection and she'll have it. You know what I mean? So I think that's what you should take home today. If you're a woman, if you're a man, and you're going to have children, check your blood group. If you're positive and your partner is positive, you guys are home and dry. But if you're negative and he is positive, you have to be conscious of the fact of this disease and take the precaution. The injection is there, it's readily available. It is in Nigeria. In fact, it was in Nigeria when I was in medical school in Benin. He had been there before me, so it's nothing new. I mean, I went into university 83, 84. That's when I went to university and left 1999. Then he had been there, so it's nothing. It's not one fancy, expensive, very scarce, difficult thing. It's just ignorance. And then, due to poverty, people would not go to proper doctors, proper gynecologists and obstetricians, or you know, people that know what they're doing, they just go to one nurse and have their baby, and then, you know. So it's poverty, ignorance, lack of education that cause all this. Otherwise, this disease is not new. I don't think there's any gynecologist or obstetrician in Nigeria that cannot handle it easily. There's no good family physician that cannot handle it easily. There's no pediatrician that will not advise you properly. So it's nothing, you know. But unfortunately, a lot of people don't know about it in Nigeria because of ignorance and, you know. So I don't think there's anything I'm forgetting, but I will look at questions. Some of the questions can cajole my brain and remind me anything that I've forgotten, because I'm saying this from my brain, so I might not be remembering everything that I need to say, but you know. So I'm gonna have a look at can have a look at the questions and see. Oh, why is this phone? Sorry, why is it saying rotate? Okay, so let me find the questions. Ajoku Loma, say thanks, we are both positive. Good on you. What's so expensive? Terminal. Emenike, yes, I graduated from Uniben, UBTH, yes, correct. Ebo, you said you took it all through your delivery. What do you mean? You should only take it 28 weeks, but I mean, obviously, if you're bleeding for any reason, you know, they can give it to you another time. Yes, Kalechi is ignorance. Steven, there, thank you. I'm looking for questions. I'm not looking for what's quite expensive here. Are you saying that anti-D injection is quite expensive in Nigeria? I'm not looking. Please, what if they mistakenly gave you the injection 2 times? Oma Ruth. I mean, you can have it 2 times if the occasion warrants. It's not going to be a problem at all. Not at all. You said it was 19K when you took it. 19K is, I mean, 19K may be a lot of money, but it's nothing compared to what your baby can go through. So that's why I don't consider it very expensive. I mean, I'm not saying, don't get me wrong, I'm not saying 18K is not expensive, but when you compare it with, you know, this disease, 18K is nothing. So let me see. Okay, go Merced injection is up to 40K. Yeah, I don't know the price, but it might be 40K, but 40K does not is a lot. It's a lot, but it's not comparable with what your baby would go through, or the fact that your baby may die or come out and become complete lodo. You know the type that if his mates are saying bad, better, best, he will say bad, badamba. And you will never understand that it's bad, bad, best. Oh, what is this superlative? You say bad, badamba. This thing causes that kind of thing. So, Nkiruk, I said, I have a friend that is positive. Yes, why would she need the injection when she's positive? I said she needs the injection if she's negative, not when she's positive. So, if positive blood does not need injection, you need to be negative to take the injection. I mean, you guys are talking about how much the injection costs. The most important thing is available. And thank you for Lashade. What is important is that it's available and it does the job. You know, it does the job. Ebo said they never checked baby blood group in Nigeria. I don't know. I believe they can check it. They can do it, but I don't know whether they do. Ogechi, the injection is necessary if you are negative, and it's not necessary after childbirth unless that baby is positive. If the baby is negative, you don't need to take the injection again. You only need to take that injection a second time within 72 hours after delivery if your baby is positive. Otherwise, you don't need. If your baby is negative, like you don't need to take the injection again. So I don't know which doctor is saying that. Thank you, Ezrim. Able, stop talking about the cost. There's no amount of money that you can equate with the suffering that your baby could go through. One Nuche was, thank you. Greet Ugumba for me. So, I don't think. Ewuzie Peter said, I'll marry from this foundation. A lot of willing brains are here. I wish you good luck. That's why we are here. At least I will be, I'm sure you're going to make me chairman of the occasion. You know, I'll come and dance and spray you money. Make a promise. In case the male is O positive and the lady is positive, yeah, that's what I've been saying. If the man is positive and the woman is positive, that's fine. You know, there's no hemolytic disease of newborn when both of them are positive. And he said if the genotype is AA and the genotype of the lady is AA, that's sweet. This that couple is fantastic. You know. Oh, sorry to hear that. You lost your second and third child because of it. Oh, I'm so sorry. Yeah, I'm sorry. Thank you. Happiness. Yes, it's good to know your blood group before going into a relationship that will lead to marriage. Correct. Tanimola. That is correct. Thank you. Quite simple to understand. Rogam. Yeah, you did well. But I don't want you to go to the chemist and say, sell Rogam to me. It needs to be prescribed. It has to be prescription only. Your doctor would have to prescribe it for you before you can have it. Don't go to the chemist and say, oh, give me anti-D injection, Rogam. I want to inject myself. Whichever. It is not up to your future husband. You, even if your future husband is not here, you will impart the knowledge on him. And it's your life. It is your life. So as soon as you want to marry, you want to know your blood group. You want to know his blood group. And then if you're negative and he is positive, then you should make sure you get the injection. After a termination, after an abortion, a miscarriage, or abortion, or after childbirth, or any procedure that could lead to bleeding while you're internal bleeding when you're pregnant. Everyone, thank you. Ogechi, yeah, thank you. Yes, thank you. Nkiruka, thank you. Igwe, you lost connection, data finished. Maybe you go buy tertiary data. All the people that Kelechi gave data today, I hope they're online. In fact, I've not even seen Vera and the rest. People should be taking down the names of people that Kelechi gave 500 naira data. I haven't seen any of them here. Hanana the Balaga. Kelechi, my blood group is O positive, yes? You know? It looks like the topic was self-explanatory. And what if the person forgets to take the injection? Oh my God. What a question. So all the whole thing I've been talking about, oh God. If you don't take the injection, it means that you will be sensitized. If you don't take the injection and you're negative, you may be sensitized. And then when you have the next baby, and if the next baby is positive, the baby's blood cells will be attacked. And they will develop the disease that can lead to all these problems I've been talking about. And there's nothing like forget. It's not forget. It's not... when I say you can have it around 28 days, if you forget today, you go tomorrow now. There's no specific day that you must take it, you know. You know, I said around 28 weeks doesn't mean that if you don't go on a particular date, if you forget today, you go tomorrow now. They will give you the injection. Yeah. And blood group O positive and my body is always hot. It's because you get hot body now. Alvan, thank you. Thank you. Thank you. All these people shouting my data. Yes, for last year, there's a probability that you can take the injection twice or even more than twice. Let me reiterate. Under normal circumstance, you will take the injection about 28 weeks, and then when your baby is born, and if your baby is negative, that's you gone. That's you done. If your baby is positive, you have to take it again. That's the second time. But during your pregnancy, if, for example, they did any procedure on you, like what we call amniocentesis, where they would need to put a needle through this thing to take fluid to do some analysis, or chronic venous sampling, or if you had a fall and you bled internally, they will have to give you that injection again. So you can have it 3 times in one pregnancy. I hope I made sense. Is there no faith? No, if people are not is there no faith for people who are not sensitized? I don't even know what to say. Blessing. Welcome. When I don't know whether the questions drop late. I don't know whether they are dropping late for me to see them, because some of the questions I find them a bit ridiculous. I'm sorry, I don't mean to be rude, but if you ask me, what if they didn't give you the injection before delivery? If you're O negative, this is what I've been talking about for the past hour. What will happen? If your baby is positive, the baby risk developing hemolytic disease that can kill the baby. So all these people asking me if they didn't give them injection, what will happen? I think you have to go back to the video and listen. Peter, my brother, I agree with you. All the people that are saying, I haven't benefited, they should come to that and benefit. I don't know what they want to benefit. They join the foundation because they want to benefit. They want money, they want airtime, they want this, they want that. But this is also something resourceful that, if I were in their shoes, I'll be happy to be listening to this and taking it home. But not, ego. Moalu Chidera, I said, I'm just discovering about the injection today. That's the essence of the teaching, at least for you to take home something. So at least now you know that there is such an injection that can, that you would need to take if you're Rhesus negative, if your blood group is the negative type. Amaka, welcome, even though you came late. Debbie, you are enjoying this lecture. Thank you. Maybe I should have been a teacher. I teach. I also teach young medical doctors, new medical doctors. I teach them, but I should have just gone to university and be teaching. I think I'm a good teacher. Oh, Chinedu, this is so traumatic. Reading what you're saying is well. Okay, my brother, it's good that you participated. Yeah. But if your data finishes, hang up. You don't need to start shouting. I'm not gonna free mode. I can't watch. You do well. Chinonso, Anele, I think there's an injection after the woman gave. I said, if the woman gives birth and the baby's blood is positive, the woman would need to take the injection. I am assuming from what I'm reading here that possibly in Nigeria, I don't know again, maybe they don't check whether the baby is positive or negative, and they just give you the injection. So if is J was J, it means that instead of wasting money to confirm, we just give you the injection, and whether it's meaningful or not. But where I practice, where I live, that's not the way it's done. Before they give you that injection, they have to make sure, the second injection after birth, which is within 72 hours, they will need to make sure that your baby has positive blood. Because if your baby has negative blood, there is no reason to give you that injection. It's just waste of, waste of the injection, waste of the reaction, waste of the needle, the pain that you go through having that injection. But I'm guessing from what I can read here that they probably don't check that in some places in Nigeria, and then they give the injection. That's what it means, Chinonso. Thank you, Victor. Thank you. La Viva Viva. Thank you. It said I can't see anything except comments. You can't see me. Am I that microscopic? I can't see anything. Queen, God punish Edafe. How are you, my friend? You okay? Yeah. Thank you, Mary Cynthia Sochima. Reggie, Uchoma's uncle, how you doing? Okay. Nemeka, yes, it happens. It happens. It's better to be late than to be never. Or never. At least you joined. You joined. Kelechi P. Samuel. I'm A positive. So is my husband. Hope we are safe. You are safe. I've given you an all clear. You are safe. For last year, yes, cerebral palsy can occur from that disease. Casmere. I'm sorry, my people. AB by blood group. Oh. No, I don't know what you're writing. Sorry. Nearly. Yeah. I think Rosemary, yeah, hemolytic disease of fetus and newborn. Fetus is that baby in the womb. Newborn is obviously as newborn. What if the father is negative and the mother is positive? Then she's carrying the baby that is negative. That's if the father is negative. No, it wouldn't happen. It normally happens when the mother is negative, and the baby in the womb is positive. Obviously, the baby inherited the positivity from the father. What caused this jaundice? Don't worry. When I come back to Kube, I'll call you to my house and teach you differently. Lord, I just answered the question. Thank you, Oluchi. Eberon, thank you. Obi, Uju, Kedu. No, so thank you. Yes, Martina, it's a serious matter. No be small thing. Precious, thank you. What names are jawbreak? Is it hemolytic disease of the newborn and fetus that is jawbreaking, or erythroblastosis fetalis, hydrops fetalis, kernicterus, cerebral palsy? There are things that you hear every day. Or hyperbilirubinemia. It's hyper, you spelled it correct, and bilirubin anemia. So it's not N-E, it's N-A-E-M-I-A. Hyperbilirubinemia. And it's one word. There's no space between. It's one word. Hyper means, increased. Hypo is decreased, So high, level. Hyperbilirubinemia means excess level of bilirubin in blood. In serum. That's what it is. When it's a hypo, less. So don't be intimidated by all those big words. They have simple meaning. If anyone blessing, thank you. Ugoma, you're here. We there here. What is the meaning of IgG? IgG is a kind of immunoglobulin G, which is a kind of antibody that can cross the placenta and then obviously confer immunity. If you have been following the story of coronavirus and immunity, you know, you probably would have known all the concept of vaccination. You know, when they vaccinate somebody or immunize somebody with a little serum or whether dead or alive vaccine, it excites immunological reactions, and all these kind of immunoglobulins are formed to protect you from that disease in case if you had it coming again. Chidimma, you borrowed 100, you do well. Yeah. Immunoglobulin, IgM is immunoglobulin M, while IgG is immunoglobulin G, correct. You do well. No, you're just coming. Welcome. IgG, initial gragra. Ebube says initial gragra. Yes, actually, it is initial gragra, but IgG actually does more than gragra. What's the connection between IgM and placenta? Placenta is after birth, what you call after birth. That you know, thing that all the nutrients pass from the mother to the baby. That when you after the baby has come, that thing that is delivered with the cord is called placenta. And I said to you, the IgM does not pass the placenta. So even if it's in the mother's blood, it will not go to the baby because it doesn't pass. Meanwhile, the IgG is the one that can pass that border. Plus, you know, there's a border, you know, and a tight border with that. So IgG will pass that border and go to the baby with the blood. While the IgM doesn't pass. And the IgM is the one that is formed at that initial stage. You know. Thank you, Florence. No, I will save the video, definitely. A breakdown of red blood cell is it's hemolysis, not whatever you wrote. Hemolysis, you know. What's so costly? Yeah, because what is IgG? They've answered. IgG is what? They've answered. People have answered. IgG is, you know, full meaning of IgG. I think somebody has answered. Immunoglobulin M, immunoglobulin G. Immunoglobulins are these antibodies, these fighters. How come we cannot see me? Oh, I hope you guys are seeing me because people are saying I can't see you. I don't understand how that works. Can somebody confirm whether I'm being seen or whether I'm invisible? Am I being seen? Am I visible? So I'm happy that, you know, most people here have, at least they will take something home. You know, they'll arm themselves with this information when they are, for those that are not married and not, you know, so yeah. Okay. This is just 9. This is just 9. Okay. So we can play a little bit before I go and, you know. So, O negative is what we call universal donor. They can sabi to donate. They give everybody, but they know they take from anybody. That's O negative. They just give. They just donate. Donatus. Donate. You know when somebody is a donatus. Now so O negative be. Donatus. You just donate, but they know they take. Yeah. Yeah, treasure. Yeah, you guys are good to go. You're good to go. I wish you guys luck. Fire on. You know, genetic, I mean, it's like saying that you're fair, you're light in complexion, your husband is light in complexion, and your child is dark. All the genetic issues do not start and end with the immediate parents, grandparents, ancestors. You know, you can see that sometimes people, a child will look like their mom's father or their mom's mother, or their the child's nose will look like the grandfather's nose. You know, so genetic issues are not just you alone and your husband. If you're, yes, you can't take from others, no. Treasure. Itorato. You must take from O negative. If you're O positive, you take from O negative and O positive. Only. If you're O positive. But if you're O negative, you only take from O negative, I'm afraid. Throw more light on O positive. That's what I just said. If you're O positive, you can take from O positive and O negative. O negative gives to everybody and receives from O negative, correct? Thank God you're O positive. Okay. Yes, O negative is universal donor. If they didn't have the chance to do blood tests and to do the matching, you can have your O negative as long as the person hasn't got hepatitis or HIV or all those blood-borne viruses or serious infection in the urine. So with O negative, you can donate to anybody. You're a giver, you're a donatus. You know, it's the AB people that are wicked people. They are greedy, they are selfish. Yeah. Ngozi, okay, take care, Ngozi Francisca. So, favor my sister, if you're O negative, then you must make sure that whenever you're going to marry, I mean, not you make sure anyway. If your husband is positive and you're negative, you must make sure that you must have the injection after any procedure, you know, childbirth, termination, miscarriage, you know, all those kind of things, as I've been talking about. And then as O negative, anytime anybody needs blood, I will refer them to you because you're a universal donor. Even Grace is universal donor. Thank you. Chinedu Ebo, you're a universal donor. You keep donating. Eudora, good evening. Chidi, my O negative universal donor, yes. Which favor, you're confused. In 1 minute you're negative and another minute you're positive. I don't know what I did. Why did this thing? I'm not inviting anybody now. What did I do? Okay. So how do I remove this? Okay. I don't know what I did. Yeah. So there isn't much questions today. Unlike last week, there were a lot of questions. So it looks like this one is less complicated. You know, it's less complicated. At least there's light at the end of the tunnel, you know. I'm back. Chidimeyeme, welcome back. Martina Felix, you're B positive. So when you're B positive, it means that you can receive blood from O negative, you can receive blood from B positive, you can receive blood from B negative. But you can only give blood to B positive, you can only give blood to AB, negative and positive, and to your own blood group as well. Yeah, if you and your husband are positive, you're good to go. No. Silver, your blood group does not change. It doesn't ever change. It's the same. So if you are told a particular blood group, and when you grew up, they gave you another blood group, then the problem is from the laboratory. It is from the laboratory. Your blood group can never change. It is a genetic thing. It will not, when you are 2 years, you're this, and then when you're the other one, you're 20 years, your blood group changes. No, your blood group stays the same. You know? Why do all these people want to join in my video? I don't want to see anybody. Don't want to see anybody. Make on a day. Make I day my day here. Choose Oba, good evening. Ucheibe, good evening. Antigen D, you will be positive and the absence is negative, yes. For Lashede. Yes. Oh, the O group means you don't have antigen A or antigen B. That's for the ABO blood group system. If you understand what I mean. Mike Nana, good evening, Daddy. Okay, thank you. You know, this daddy you're calling me before my wife be watching and think that I have one son or somewhere else that she doesn't know. So take her easy, they call me daddy, I beg. Diamond, welcome. How about the latecomers? Ugoma, welcome. I will post the video at the end of the day for you to listen. For the 4 blood group, that's the ABO system. Yes, ABO. Yes. So Nelly, say you're AB. Good on you. You know. Abby Lincoln. How far? What name? How Ghana? Kwama, you're just coming in. You're just coming home. Okay. Joy. Deo. Iyochia. Hello, my man. How you doing? So all these people screaming free mode. So how come they could come online? Okay, all right, I can understand now. Yeah. Folashe, it looks like you're recapping what I said. That's good, you know. Correct. Kennedy Ohadua, yes. Antigen are like enemies, antibodies are like defendant. Correct. Aptly put. Chikodi Amos, good evening. Victor, thank you. Benjamin, is it Chefe? Diego. Ride on, Obioma Purity. I don't want to hear anybody say my data is finishing or my data. Chidima, if your data finishes, just go. Did anybody use rope to tether you to this live teaching? Hey, Kashmir, good evening. Ifunanya, good evening. Martina Felix, good evening to you. Chidima Eche, thank you. Comrade, John Bosco, Ndewo. Stella Oge, good evening. Ajoku Loma, good evening. Good evening. Lillian Chikamso, oh yes. Looks like you're just joining in. I haven't seen you all day. You're always there. Chukwuemeka, my man. Thank you. How are you? I didn't see your Chukdi, your man. He has scampered, you know. Anderson, thank you. Thank you. Vera, you always coming late in a church. When father wants to say amen, that's when you enter church. Very weird. Anyway, you came. I will save it. Chidima Cynthia, good evening. Why do you guys say good PM? Is it that you can't write good evening? Good PM is PM. What's that? Is it you're stingy with words or you're saving data? I don't understand why people say that good PM, good AM, HBD. If on my birthday you wish me HBD, I don't respond. What the hell is that? Edith Onyi. Yes, Constance Cheesy, thank you. Pamela, my weekend is going on. I'm hanging in here. My weekend is going all right. It's going all right. I'm happy. Adiola, good evening. Patience Joel, thank you. Edith Onyi, how are you? Samuel David, good evening, my brother. Ifi Ada, you're here. Don't worry, welcome. We day here. Chick Pretty, happy weekend too. Amara Free Mother, Amara Grace. You know, Adeze Igwe, good evening, my sister. Vin, Wandemuke, Olea. You know, Ezri Muchechukwu. I didn't get any airtime, but I'm here live and direct. That is the spirit. You don't have to wait till you get airtime before you learn. You know, you're not paying me for teaching, so you can just buy airtime and learn. You know, I learn too, and nobody gives me any airtime to learn. Tender Ruby, good evening, welcome. Debbie Counting, you're here too. You've marked your register. Here's the one. Good evening. Peace Prince, good evening. Ugo Concilia, good evening. Perpetual, God's gift. Thank you, Chidimaya. It's good network and good phone and good speaker. That's why everything is clear. Better soup, no be na money kill am. No be so that they talk. Dozier, my man, Kedu. My big brother, Rhesus. Good evening, sir. Hello, Tero. Okay. Kelechi, Pastor, you still there here? Thank you. Is it? I'm just wondering whether is it previous messages that are coming, something, or I don't know. I just don't understand how this thing. Some of the messages, comments I'm seeing, they seem to. I don't know. I'm not looking. I can't see the time they were dropped, so I don't know whether I'm just responding to, you know. I don't know what is current, what is new. Ukachuku, you needed to benefit. I hope you have benefited. I pray you did, or you have. You know. Udochi. Ezinne. No, yeah, Ezinne said this welcome on board hours ago, ages ago. So it looks like the messages are keep recycling. So I don't know. I don't think any of them is fresh or new. You know, they're just not saying anything again. Let me see. Has everybody gone mute? Nobody's asking me any questions again. How do I know whether there are new questions? No. Is it when I... Okay. Emenike said I'm serving a UPTH. Okay. What do you do? Emenike Amarachi, what do you do? What are you doing in UPTH? Right. No, Folashade, nope. Has nothing to do with your miscarriage. I like this amicable Amarachi unable. We're not sharing any honey here. Anybody that their data has exhausted should go. We will talk about something else at another auspicious time. I'm just thinking, you know, from the day I did the giveaway about people who needed money for medical treatment. A lot of people kept saying, I've got typhoid, I've got typhoid, I've got typhoid. And that got me thinking, because I know that 90% majority of them don't have typhoid. So I'm thinking that I probably would have to talk about typhoid fever, so that most of you understand that, you know, those things that those quacks tell you that it's typhoid, it isn't typhoid. You know, everybody has typhoid. If you have runny nose, you go there, they say it's malaria and typhoid. If you got diarrhea, you go to them, it's malaria and typhoid. If you vomit, it's malaria and typhoid. No matter whatever is wrong with you, they say it's malaria and typhoid. For crying out loud, that's ridiculous. You know? So I'll see how my program would be for weekend, and see whether we'll talk about that typhoid if people want to hear it. You know, because I'm really concerned about I'm really concerned about the propensity of that misdiagnosis in Nigeria, and then people just go up antibiotics anyhow and develop antibiotic resistance. You know, so when they need to take the antibiotic, it wouldn't work again. You know, so it touched me. So I probably would ask if people want to hear about what are the symptoms of typhoid, how do you actually make a diagnosis of typhoid, and explaining all this without test people go to do. You just go and do without test, and they say somatic antigen is 1/80, flagellate antigen is 1/320, you got typhoid, and they prescribe all sorts of things for you. You know, that is not the way it works, you know. But Trauma is asking about somebody that has I believe you're talking about hepatitis B. What medication will she get? I will not discuss medication that you use for hepatitis B because it is not something to self-medicate. But hepatitis B is a very, very, very serious viral problem of your liver that is so terrible that it could lead to chronic liver disease, and you can have cancer from it. You could die from it. So it's not something that somebody recommends medication for you over the internet and you go and buy. You need to see a hepatologist or somebody who knows about hepatitis B and or hepatitis illnesses, and they give you the appropriate medication after doing all the tests, all the liver scan and all that. So it follows a process. It's not just, oh, I've got hepatitis B, go and buy Havonite or go and buy any antiretroviral tablet and take. Yeah. Oh, no. Some Tochukwu said, is there any blood group where the woman can't have a child after having first child, except she's given a particular injection? That's what I've been saying. If your blood group is negative and your husband's blood group is positive, and the first baby you had was positive, and you become sensitized, then you can have a child. You can be pregnant, but that child could die. Yes. So if you're negative and you didn't take precaution, you didn't take the injections, and then you had your normal baby, the second baby may suffer, may die. Or you may never, and all your children may just be dying, because there's no treatment at that point in time. All these blood transfusion, auto transfusion, all those will be, things that will be to treat. It's not to prevent anymore, to treat that very ill child. So, yes, any problem with the third child? Yes. As long as that child has the positive blood, if the child has the same negative blood with you, that's fine. What is the full name of IgM? I don't know when this question was asked, whether it was asked after it was answered, or is it a fresh question? If it's a fresh question, it's immunoglobulin M. Ig is immunoglobulin. Ig jigalagra. Yes, so learning disabilities. Can you say, those days in nursery and primary school, they say the superlative and comparative of bad. They say bad, better, best. But after having this disease and you have learning disability, they say, it's bad, bad, bad. No matter what you say, oh, beautiful, more, beautiful. They don't know how to say beautiful, more beautiful, most beautiful. So it's all learning disability from this. Gozier, it cannot stop you from getting pregnant. It has nothing to do with fertility. You can be pregnant, but the issue is what happens to that pregnancy is the matter. Oh, that's an interesting one, Lillian. That's a good question. If the injection is given to a mother who is positive, I guess it won't do anything today. It's just a waste, but it's not going to cost any harm. It's not going to cost any harm. I don't believe it's going to cause a harm, because obviously, if the woman is positive and the husband is positive and the baby is positive, there's no immunological reaction. So there's nothing to mop out from the system. So it's just probably going to be, it's not. I don't believe it will cause any harm. But it's just waste as far as I'm concerned. Margaret, thank you for being proud. So Nancy, you've gone back to sickle cell this thing. I have the video in my, and I'm not going to go back to this sickle cell talk again. You know, if you're AA and your husband, how many AA am I going to have? You may never have an AA. Or you may, all your children may be AS. All of them, but obviously 75% chance is AA. Because your AA and your husband is AA, the chances of you having an AA child is 75%. I'm not gonna tell you how many children, but 75% of your children are likely gonna be AA. But there's a chance that all of them could also be carrier. It's like when you're doing calocal, isn't it? You don't know which one you're gonna get. Christian Ike, I'm afraid I'm not going to be able to repeat it. I will drop the video and you watch it. You know. Yes, Kidney is positive. It's possible from other parents, grandparents, and all that. Yes, it's possible. It's possible. Okbar Kenneth. What is that? What is if the problem doesn't occur? The problem occurs in the second pregnancy. The woman will not notice that there was a problem in the first pregnancy. That's what I said. It doesn't occur. It's the second pregnancy, you know, that stayed, not pregnancy that you aborted, you know. Yes, Makwa Chuku. Yes. I don't know what's your blood group. Are you negative? Grace Wallo, what is the topic? If you ask me, who will I ask? I don't know what the topic is. Dr. Umana for welcome. Osaho, woye. Osamo demuda, woye. Osewe. Yes, I will save it. Yes, can the baby's blood group can be checked before childbirth? Yes, it can be checked while the baby is in the womb. Medicine has advanced that far. It can be checked. Yeah, absolutely. O positive and B positive. Yes, that's no problem with that. Can error occur when having blood tests? The error is from the person doing the test, or the reagents, or the equipment. But if the equipment is good, up to date, the reagents are good, and the operator, that's the lab scientist or technologist doing the test, knows what they are doing, there is no reason why there will be error in checking your blood group. It is not a complicated test at all. Good on you, Welly Godwin. Welly, are you equal? Well. Could this be the reason why some couple after the first child are unable to conceive again, or in some cases keep having? Yes, Chukdi, possibly. It is a possible reason. Yes, of course. You know, of course. Yeah. So your second, that's why some couples, after having their first child, normal, from second, the babies keep dying, or they keep having miscarriage. It's because of, this is a possible reason for it. They will not, you know, they keep trying and their baby keeps dying. Their baby keeps dying, you know. No, if the man is negative and you're negative, there's no point for injection. Colossus, I didn't say anything. No, don't go and put me in trouble. There was no way I said that if you're positive and your children are healthy, it means that your wife is positive. I didn't say that. I never ever suggested that. Mike Kelechi has come with his wahala. I'm not going to go into that now. Go and be doing all the research and be asking questions that are not relevant to what I'm talking about today. What is the name of this injection? Rogam. Anti-D injection. Chinenyonu Rogam. It might have different trade names. You know. Let's go and ask the guy. If you're being positive, you're fine. You're fine. Oh, good. I'm so sorry to read this. You know. So you said I gave birth 4 months ago, but the baby died in the womb. That's what we call stillbirth. But I gave birth to him. That's stillbirth. Later, after I get discharged, after 3 weeks, I went for pelvic ultrasound. I was told there's fluid in my womb. I went back to hospital and they wrote antibiotics for me. Oh my God, good. I don't know what they mean by you have fluid in your womb. I mean, if you had retained products in your womb, you know, that means all the products of conception were not expelled during your childbirth. Maybe something was left there, you know, maybe part of the placenta may have been left there. So if you have that could cause infection, you know, and you have future evidence of infections, you know, so antibiotics may help. But I'm not quite clear what the ultrasound keeps saying to you, that you have blood liquid in your womb. I don't know what exactly. Sorry. Thank you. Comfort in Jogo. Yeah, you're here finally. Welcome. You do well. You're fine. That the problem is normally if the woman is negative and the child is positive, that's when you normally have that problem. Peace. John Wee here. Yes, thank you. Okay, Nancy, you're one of the beneficiaries of Kelechi and you actually came. Good on you. You're the first one. You know. Eudora, thank you. Let me see when I'm going to go away. Okay, I still have half an hour and then I shall go. I need to talk to my daughter and my wife tonight, so I shall go at 10. Edwina, this is really clinical meeting. Yes. Do you work in the hospital setting? Yeah, this is Athanasius. Yes, thank you. Okay, Nemeka, you also one of the people that got airtime from Kelechi. Good, you got integrity. These are the people that I like. Mike, if you say so, it is possible. It is possible. It is possible. I can't say yes or no, but yes, it is possible. Amen. Yes, I will save the video. Chukdi, how do we do that? You know, how would you buy data for them directly? Or how do you do that? You have to explain it to me, because I know that most people that get data for these things don't come. They use it for other things. Nigerians. Edwina Okwando, thank you. Leo, you don't land like Land Rover. Welcome. Asomba, you're missing. Chinedu. It looks like this my teaching is bringing back memories, bad memories to you. You know, I wish you all the best. You know, I just hope you're all right. Onya Ijoma, yeah. In case it, my dear, knowledge is power. Blessing, Obonya, yeah. Thank you. Obi, my brother, I can see you're watching. Leo, your battery was done. Oh, sorry. Don't worry. Diamond, Daluso. How was the problem handled? I'm not... that the fact that I said I was an ancestor, Linda, does not mean that I know how they handled it when I wasn't born. But this anti-D was, I think it was discovered possibly, I don't know, I think it's 1950s or something. I'm not so exact. But before then, people just they die now. They just they die, they go, my dear. You know, medicine has advanced, then people were just dying. They were just dying. Thank you, Precious Chinaka. Thank you. At least you can say you've benefited. When they say, oh, it's a scam, we're not benefiting. Oh, this group is... I said, what are you scamming? Somebody will be using his time, his money and everything, and you say it's a scam because you didn't, you haven't benefited. Well, nearly 17,000 people. Isn't it clear to you that it is not possible for me to give 17,000 people money at the same time? Isn't it possible? I mean, isn't just common sense that there is no way I can give 17,000 people money at the same time? So it's going to be a chance thing until such a time, God, you know, you may be the one that will be touched. But thank you. We are good. Thank you for the prayer, amicable, honorable. Oh, amicable, potential Father Dikanya. Yeah, man. I don't understand that men answer amicable. So it's confusing me. You know. Yeah, your O positive happiness and your go. Thank you for being impressed, Choma Ike. Good. I've answered your question. I believe this is a recycled question. I answered your question. Amarable Louis, network is not allowing you. Agogoa Jacinta, thank you very much. Uchend, what causes hot blood? What the hell is hot blood? My body is always hot. I don't know, but if you're always hot, there's something we call heat intolerance. So if you're always hot, I would advise you to go and check, do 1 or 2 tests. You do the one we call full blood count, and you check your thyroid. What we call thyroid function test that checks your thyroid stimulating hormone, your thyroid T3 and T4. So if you do suffer from what we call hyperthyroidism, you could always feel hot. Even when the weather is cold, you're hot. You may have other symptoms like, you know, always being irritable, diarrhea, rough skin, problems with your eyes, you know, things like that. It's called hyperthyroidism, and I mean, it could be serious. You can develop what you call thyroid storm. You can develop, you know, thyroid toxicosis. These are things that can happen. So if you do feel hot, I would advise you to go and have your thyroid function test and do a full blood count, and then give it to somebody who understands what it is. Or if you haven't got money to pay a doctor, if you get the test, send me the result. I will interpret it and advise you. Thank you. Godlin, yes, I will save the video. Chimwanya, thank you. Nothing will happen, Stephen. They are fine. Oma, nothing they happen. I took my own after delivery. No. Chinedu, you cannot, the one you're taking after delivery doesn't mop up the baby's blood, positive blood. Immediately, you need to take the one at 28 weeks to do that. Then the one you're taking after delivery is to prevent you developing that reaction for the next baby. That is if the baby you've given birth to is positive. If the baby you've given back to is negative, there would be no need to have another injection after the delivery. Amicable, I will save the video. Okay, I think Mike Kelechi's questions keep recycled. The same question. Melrose, yeah, you're here. Welcome. Yeah, so that's a good idea. Thank you, Chinedu. I appreciate the fact that you appreciate this lecture. It's more than money, and also the interaction. I will save the video. Onya Ijoma, is this part of what causes chromosomal abnormalities? Nope. Chloe wants to about fibroids. Okay, we'll see. Yeah, a healthy man is the wealthiest man. God bless you. Thank you. Thank you. Mike, I agree with you. It's more than free giveaways. But, man, I go on over. So guys are not interested in things like this. They rather have the 5K, 10K, 20K, what have you, or even 500 airtime than listen to things like this. They will say, who the lecture app? Who this thing app? You know? Okay, Chikaduru. Thank you. Thank you. Blessing, Obuonye. How come Stanley Red is watching? I thought this only people in the group will be able to watch. So I don't know how my man Stanley Red, who is not in the group, is able to watch. Chukdi, if you're online, how after you explain it to me, how can somebody who is not in the foundation be watching? How does this work? Okay. Okay, Marco, you're a biologist. No wonder. I can see that. All right. Are you a student, Marco, or you working? Are you graduated already? Oma, no problem. Oma Ruth, no problem. Happiness, Anyoago, welcome. There's always a first time, and I hope you had a nice time getting involved in this exercise. Thank you. I don't understand. Ask very well to avoid admin. Please hold my ID. I don't understand. Godly, can you please come again? Godlin Ejofo, I didn't understand what you said there, what you wrote there. Yes, Margaret, everybody says that to me, that I would make a very good teacher. Everybody says it to me, but see, I'm already ancestral now. But maybe when I come back to Nigeria to settle down soon, by the grace of God, I will take time out to teach medical students. I teach here. I always teach, and my students, the doctors that I teach, when I do have chance to teach them, always enjoy. And also, the nurses that I teach all the time, when they're in my clinic, they learn a lot from me, and it's always a thing of joy and pride to impart knowledge on people, you know. So, yes, Kelechi, yes, the topic is relevant. That was why I decided to take it up. You know, from last week's conversation, I realized that a lot of people were ignorant about it. So I decided to take it, and I'm happy that people enjoyed it and took things home. Marvelous, thank you, Leo. So Leo, you're a woman then? You're a girl? I thought Leo was a man. I mean, all these names confuse me. I don't know why people just use. Oh, where's everything? I don't know why you guys use Oh, where's the I can't find all those messages anymore. They've all disappeared. My viewers. So where are those questions? No. So how do I remove all these people? I'm looking for those questions. Where are they? I don't know where the questions are, to be honest. Questions have disappeared from my screen. What should I touch for them to come up? What thing I go touch now? What should I touch for those questions to... Oh my God.